QRS Retail Revenue Cycle platform can be configured in many ways to achieve the revenue cycle goals of your organization. For large healthcare provider networks, the Health QRS platform can support an open medical marketplace for current and potential patients to access medical services across multiple hospitals, urgent care centers, clinics, specialty practices, imaging centers, laboratory facilities, rehabilitation centers, and more. For narrow networks and healthcare practices, the HealthCare's platform can be configured as a closed network of convenient healthcare and medical referral options for your active patients. For both large and small providers, the HealthCare's platform can be implemented as an easy-to-use yet very effective retail revenue cycle system that manages the patient census, providing pricing transparency and collects upfront payments at the point of service. Let's take a closer look at the Health QRS point of service capabilities. The Health QRS system can manage walk-in patients or rosters of patient appointments and can manage upfront payments, which improves payment collections. The Health QRS platform can directly manage patient information and synchronize patient information with your existing hospital or practice management systems. The Health QRS platform provides tools for tracking payments and collections by facility or sorted by each staff member taking payments. Health QRS supports a broad range of self-administration options, giving your practice or facility complete control of available procedures, contract pricing, appointment times, discounting and charity rules, reporting options, and more. And when a referral to another healthcare professional or facility is required, the Health QRS platform can even provide pricing transparency and appointment availability, along with a range of referral options across your network of healthcare delivery partners. Here, we see a census of today's appointments available to the front office administrator. Appointments can be sent from the hospital management or practice management system in real time or sent in batches. It is common for a roster of the next day's appointments to be sent over in a batch. The Health QRS platform can verify the patient's formal name and address, verify the status of the patient's insurance, and update the patient's year-to-date deductible and maximum out-of-pocket balances, and identify any unpaid patient balances, all before the patient arrives. Facilities with a large daily census can search for patients by name, physician, time of day, and more. Also, the front office administrator can easily search for past and future appointments to answer patient scheduling questions. Today, Earl Winter is here to see Dr. Langen. Let's see how the front office administrator checks him in. The first thing the front office administrator is asked to do is validate the patient's identity and verify the current address, especially for pediatric patients who may have multiple insurances or addresses for each parent. Any inconsistencies in patient name, insurance, or address could result in claims denials, higher administrative costs, and delays on the back end of the revenue cycle process. Incorrect patient information is flagged within the Health QRS platform to prompt staff to update the information in the hospital management or practice management system. Changes to the hospital management or practice management system are sent back to the Health QRS platform through an automated gateway. This way, all systems remain synchronized and up to date. Accurate patient cost calculations rely on current insurance deductible and maximum out-of-pocket balances. Here, we see those updated patient insurance balances. Earl Winter has been verified and his insurance and address are validated, so we are going to check him in and collect an upfront payment for today's services. The appointment charge details screen summarizes the copay to be collected today, any open prior patient balances to be collected today, and any procedures or services that have been scheduled today, net of any amounts that the patient's insurance would be expected to pay based on the payer contract with the service provider. The total due is the patient's cost, and when no additional procedures are expected to be performed, the total amount can be collected before the patient even begins their appointment. Procedures can be added, updated, or deleted by pressing Edit Procedures. Note that within the Health QRS platform, there are on-screen instructions for the front office administration to follow that help guide them through the process of navigating the platform and successfully collecting the patient's payment. This provides a consistent customer service experience and improves the overall financial results for your practice or facility. The Health QRS platform automatically checks for medical necessity. Medical necessity checks include incompatibility between diagnosis and procedure codes, improper procedure for patient characteristics, improper procedures for a particular facility, and more. Medical necessity checks are a must for Medicare, but may be useful for other payer programs. Medical necessity reduces claims denials on the back end by improving data accuracy on the front end. Back on the appointment charge details screen, the front office administrator can guide the patient through their choice of payment options by selecting Choose Payment Options. Payment options include two important patient choices. The first is the amount to be paid by the patient, including any prompt payment discounts, payment plan options, or charity discount programs offered by the healthcare service provider. The second is the method of payment that the patient wants to use to settle their patient cost. Payment methods include credit card, debit card, health savings account, checking account, and cash. Here, we see that the healthcare service provider is offering the patient a 25% discount for paying the full amount today, a 20% discount for making an initial payment today and arranging for 2 other monthly payments, and a 15% discount for making an initial payment today, plus arranging for 5 other monthly payments. In all 3 payment options, the full payment of the net patient financial responsibility is acknowledged, provided for, and scheduled today by the patient. In this example, the patient values the prompt payment discount and decides to take the 25% discount for paying in full. Next, the patient needs to select a payment method. Payment methods include a credit card that can be entered by the front office administrator right into the Health QRS platform, a credit or debit card that the patient swipes using the healthcare provider's credit card terminal at the desk, a direct patient payment using a check or a checking or savings account number entered into the Health QRS platform by the front office administrator, or cash. While cash is not a common method, it does occur for smaller items such as copays. The Health QRS platform keeps track and reports on all of the payments taken by the front office administrator, which is collected using the Health QRS platform. In this example, the patient hands a credit card to the front office administrator. The front office administrator reviews a final written statement of the transaction with the patient before the credit card is used, as required by the banking industry. The front office administrator presses Take Payment, and the Health QRS platform responds with a secure PCI compliance screen. PCI compliance is a banking industry security standard that helps ensure that important patient financial information, such as credit card information, is not stored in an unsecure manner. PCI compliance is as important as HIPAA compliance when it comes to patient data security. Here, the credit card information can be securely entered. When card details are held for future transactions, no credit card information is stored in the Health QRS application, locally or in the Health QRS cloud. A token is issued by the PCI-compliant credit card processing service, and future use of the credit card is managed using that secure token. A full receipt can be printed or emailed to the patient right from the desktop. Individual payments are tracked and receipts are stored in the Payments tab. By selecting Payments, the registrar or front office administrator can see, sort, or search for any payments made within the Health QRS platform from their facility or department. Click on Payments to view, print, or email receipts that have been saved. Receipts and updated payment information can also be posted to other practice management or hospital management systems, patient portals, or other business systems. With a greater personal stake in their health care, patients are demanding more transparency in service provider cost, quality, and availability. Health QRS was founded to provide innovative retail solutions for patient payment, navigation, and engagement. We provide a scalable, secure, and customizable cloud-based platform that can seamlessly integrate into your retail patient processes and systems. Health QRS solutions ensure pricing transparency for the patients and a platform from which the service provider can collect the patient's financial responsibility as early as the scheduling point of the process or as late as the point of service itself. This increases service provider revenue and cash flow while lowering bad debt, denials, and compliance costs, and improves the overall quality of care for the patient. The patient saves money, saves time, and manages their deductibles and copays more effectively, while you improve patient service and navigation options, reduce your costs, and increase your cash flow. Health QRS, where better health takes flight.